idea of this documentary started with the desire of us as public health to capture some interviews and stories, and I thought, that's gonna be a very cool project. Little I knew that it would become something way bigger, and when I saw people sharing their stories and how they overcame so much in life, watching their tears and how, they went from tears to smiles, it was priceless, and it was definitely a transformation process in my life. Steve Jobs once said that the most powerful person in the world is a storyteller. The storyteller sets the vision, the values, the agenda for an entire generation to come. This documentary is not about what us as public health daily do for work. It's about those individuals and their stories and how they turned their life around and went from point A to point Z. And those stories, to me, represent voices of transformation, voices of hope, voices of resilience.
Issues like homelessness can be overwhelming, complex, and seem impossible to tackle. However, if we examine the needs of the individuals we aim to serve, as well as engage with our community partners, the solutions begin to become clear, and the path is illuminated. Together, we can work towards a community where everyone has a safe place to live and the support that they need to be successful and fulfilled. Every person's story is unique. We all make decisions and respond to the twists and turns of life's paths the best way we know how at the moment. There is so much more to homelessness than what the world is telling us. Mother Teresa once said, "We think sometimes that poverty is only being hungry, naked, and homeless. The poverty of being unwanted, unloved, and uncared for is the greatest poverty. We must start in our own homes to remedy this kind of poverty." On September of 2022, Grays Harbor Public Health leadership and staff members performed a homeless outreach, collecting survey questions that helped our agency to hear and understand under different lenses the perspective of folks living on the streets. Community outreaches helps agencies like Grays Harbor Public Health to collect information and better assess the specific population needs, guiding them to the appropriate resources.
I'm Sandra Rowe. My maiden name is Curly. I'm a local. I was born and raised here on the harbor. I was raised in Tahola, and I've lived in Aberdeen, hopefully, the majority of my life. And this is my husband.
I'm Simon Rowe. Grew up in Oklahoma, but I've lived here for approximately 18 years, off and on. And
Simon and I, we had became homeless here in Aberdeen. Was it 2017?
Yes.
And we got evicted, and we ended up becoming homeless here in Aberdeen. We lived in Tent City and Hoquiam in Aberdeen. Then we ended up at the Chehalis River behind Safeways. And we had also struggled with meth addiction. I struggled with the meth addiction for 24 years. And I'm a mother of 10 children, and I had either lost my parental rights or gave them up because I didn't think that I was ever going to get clean. I'm going to get emotional here.
That's fine.
But God delivered my husband and I the same day and the same time. We got tired of fighting. We got tired of the lifestyle or surviving, I should say. We were tired of surviving from day to day, being homeless, and we were missing our family. We went to the mission every morning at 7 a.m. to have breakfast. And then after the mission, we did the best we could to stay away from the river and the people because we didn't want to be triggered, and we knew that they would try to just come and reel us back in. So we hit all the local resources, and some of them we hit more than once, twice, 3 times a week, and they got tired of us. Some of them were just like, "Oh, I here they are again. But we're like, we're here. We hit like Catholic Community
Catholic
Services
Community.
is the one we got hooked up with mental health, and that was a big, huge thing that we had struggled with, was mental health from a lot of trauma and stuff that we had, endured throughout our lives. And then we hit CAP office, and we got hooked up with them, and the CAP office has still to this day been a huge blessing to our lives, because that's how Simon got his current job as well.
Right.
And the main one would be Kaleo Church, is the one. Eddie and Alina from Eternal Love Tattoos was one of our main people that helped us as well. They just welcomed us in with unconditional, Christ-like love, and they didn't pass any judgment on us.
The problem out here is a lot of people have the speculations out here about, oh, these people are bad, they're terrorizing the town, they're all hooked on drugs and everything. We have to realize that addiction is more than just this desire for this thing. These people have a trauma. And that's why we went to Catholic Community Services. It wasn't just for the FCS program to get help for housing. It was also so we could heal. The day we got clean, that's, it was ugly that day, but it's one of the greatest days of my life. It's
All right.
It's funny, we look back in the past and there's so many times that you see those hardships in your life that turn into the best days, because that's what made you who you are today.
Absolutely.
So, we're just out here trying to promote hope and lead people in the right direction. There's so many resources out here. If people are hungry, they're going to look for them.
Right.
I think the first critical element, and it's not necessarily unique to Grace Harbor County, but is physical space for people who are experiencing homelessness or at risk of homelessness. And that includes emergency shelter beds, as well as affordable housing units where people can live long term. We have a long list of individuals who are eligible and interested in these resources, but are still seeking that housing unit, whether it be an apartment or a house. They might be working with our partners in the community, like Coastal Community Action Program or the Housing Authority of Grace Harbor. And because of their income and other eligibility criteria, they are interested and eligible, but they are unable to find that unit to move into, even though we actually have financial assistance for them to get them started and to get them stable in that housing. But they're just looking for that unit, and that can take a really long time. It can be a really frustrating process for folks who are also navigating a lot of other challenges in their life.
The first one was community and learning where those resources were. Second, I think would be definitely my recovery. I had to just put all that aside and get my mind on straight in order for me to even think where to go with finding work and how to maintain that, not just get a little bit of cash, but how to actually hold on to a steady income. That took a sober mindset. And then third, mine is probably just family. I base a lot of my life around my family. I can't say that for everyone, but for me, it's definitely one of the biggest things in my life. So that's about my third and probably most important step. From there, I decided I needed to pick up my life and get a job and get my life together. So I started focusing more on job hunting every day. I would use local bathrooms at the Safeway or Walmart or wherever I could find to clean myself up. I had one set of clothes for job hunting and just clothes for afterwards that I could walk around my daily life after. I'm in the first apartment with my name on the lease. It's been about 10 years since I had my name on a lease, so that's a huge deal for me. My sons are home, they're doing great. You know, finally put my life together, got a car. I can't even imagine life without it anymore. I don't ever want to, but you know, it took a lot of motivation. My recovery had to be like a solid thing in my life. I could no longer put that aside. I had to focus on my recovery and just getting my family back together and putting myself together. But I found local resources and help. I learned to ask the right people for the right kind of help, and changed my life. So that's how I got here today.
So I think that the gap exists between needs and those needs being met. Several things. One, in Grace Harbor County, the issue about the homeless has always been about the where. What I mean by where is, where are we going to locate a facility that could meet the needs of all the folks, including low barrier, medium barrier, whatever you want. That can also include all the services that the homeless need, which would be transportation, access to documentation, getting a job, whatever those needs are, mental health therapy, substance use disorder therapy. We need to have that as a central core piece of our homeless housing strategy. And it's difficult in this city to find this place where it's not controversial, that folks would all agree that it would be a good place to go, that's accessible to the homeless, where they can walk or take a bus to get there. That's where the key is. And I think that the trouble is that when we've done this for the last 2.5 years, finding the where has been the hardest part.
While I was incarcerated, I was trying to get drug court, and the officer that arrested me, you know, he came in and visited me. He knew I wanted to change my life. I was trying to get drug court after several months of me trying and them telling me no, and the officer that arrested me, which would be Officer Neal, came in and visited me, and he came in and visited me. He noticed that they kept telling me no over and over, and he said he was going to see what he could do about it. Not to get my hopes up or anything, but he came back a few times later, and then he told me that he wrote a letter to the prosecutor stating how he really thinks that I want to change my life, and that drug court or the therapeutic court program needs to give me the opportunity to prove myself. And yeah, that's basically how I got drug court. And without Officer Neal, I definitely wouldn't be where I'm at today. He still continues to check up on me all the time. Without him and drug court, I definitely wouldn't be where I'm at today.
I believe the third critical element is the right model or recipe for connecting all of the different parts of the system so that they can work together. Research also shows, and I think most people in their own experience understand, that when people really buy into a plan, especially when it's for things like recovery and treatment, the best results come from that buy-in, from individuals saying that they're ready and that they're willing and that they agree to the plan that's going to take place. So getting that buy-in, getting that input on the plan is really important. And we know also from a lot of research that that really comes together when people feel safe, when they're out of that survival mode and they're no longer thinking about where they're going to sleep, where they're going to get their next meal, and whether or not they're safe. Then they can really start working on that longer term plan.
So my name's Cassie Niscoda. I come from 7+ years of addiction and homelessness. So I got connected with CAP, PCAP, the Aberdeen Municipal Court System. I had a lot going on in my life that I needed to get squared away. They helped me get connected with different resources in the community, like SUD treatment, housing, everything to just kind of start, bettering my life. And here I am 4 years later, Almost 5 years later, clean, working for CAP, been there for 4 years, have kids, have housing, have a family of my own, and doing great.
My name is Lauren Neal. I've been a police officer in Aberdeen for a little over 9 years now, I'm very passionate about our community. I remember many years ago when I first started dating my now wife that it was very much a community that had doors open all the time. People didn't lock their cars, and then when I saw that change over time, I wanted to try and make a difference and bring that back, and so that's kind of what got me into it to start and want to pursue law enforcement. And I think it's really difficult for people to get out of a situation of homelessness or a situation of addiction, but there are certainly a few common denominators. I mean, I know that the state's tried a number of different methods, whether it's Department of Corrections mandating jail time if they don't check in or whatnot, but the different resources that Aberdeen has, whether it might be a CAP office or I know some people that use the cold weather shelter, and they find that that has helped them out, especially in really cold times in the winter here can be kind of harsh. Also a new organization, Destination Open Recovery. They are really reaching out to people on their hands and feet down on the street and navigating what can sometimes be a complex area of getting resources, getting treatment, and those types of things. When I approach people that maybe they've given up on themselves or their families have given up on them, just seeing someone else have hope in them that they thought was gone has helped out significantly. And it's amazing, I think a lot of people get into law enforcement to try to change people. What I've found is that the people I have met that I continue to speak with, and I can name a lot, they know who they are, that have my contact info, but they have left an impact on me and continue to be encouragement for me in a line of work that can be challenging.
The 23-year addiction to methamphetamines, and he removed that from me the day that my daughter was born, and she was born into opioid withdrawals. It took her suffering to break me to pieces. And when I surrendered everything, that day that I completely surrendered and let go of all my pride, let go of all my earthly desires, and I just surrendered it all at his feet, he built me back up how he wants me to be. I do team up with Sergeant Lauren, and we always go out and show that we have love for our community, especially for our less fortunate that are struggling with addiction at this time. We go out and we show them, we demonstrate to them, not with words, but with action, that we genuinely care about them and that they're worth loving and they're worthy of our respect and our dignity. And so that's what our society doesn't want. They just want to put them in a dark corner somewhere and forget about them. Yeah, babies. And so my heart was changed from a heart of stone to a heart of flesh that feels compassion and love for my fellow brothers and sisters. It's one of the things that I'm grateful for every day I wake up, that I have stability in my life, that there's a solid foundation under my feet.
So when we think about providing housing as that essential need, we think about all the steps that we're putting into play to try to reduce that level of trauma. If an individual is not housed, they are constantly in survival mode. And so when we think about fight or flight and any survival methods, whether it be drug use, if they are crimes in the form of survival, all of those things can start to reduce and allow that individual to heal or that household to heal and start to make those choices of change and seeking out other opportunities, getting them connected to a behavioral health provider, getting them connected to a job, stable nutrition, if they have children, getting them enrolled into school. And then when we think about breaking that cycle of poverty with a household, having that constant home available to that child, that sense of stability, we are putting into place that level of prevention for future generations.
So my name is Greg Claycamp. I am the Development Director at Coastal Community Action Program, and I actually want to mention a couple of gaps because I think they're both really important to this topic. One is just the lack of affordable housing in general in Grays Harbor and Pacific counties. You know, the whole coastal area hasn't had a lot of development of new housing in decades. It's been an economically depressed area for many years now. The other thing that I think is really lacking for us is some kind of permanent shelter. You know, without those housing resources, people don't have a place to go. We have large populations and encampments on the rivers. And just in pockets all over, not just in Aberdeen and Hoquiam, but also on our beaches. And it's a real problem. And, you know, we all have an image of what a homeless person is, but it's a lot of different folks. It's families with children. In our beach communities particularly, it's older adults who are living in RVs that maybe aren't safe in the winter. And so we really have to focus on, until we have the housing stock, where can we put people where they'll be safe and have a chance, if they are struggling with recovery, with substance use, with behavioral health, to get stabilized and have that opportunity to succeed.
At Coastal Community Action Program, we have developed a homeless housing system of care that's a little bit unique. And we're pretty excited about it, and maybe even a little bit proud of it, because we're seeing outcomes that are very good. Sometimes it's hard to tell in the community because we still see homeless people, and that's a reality, but we're seeing so many lives changed. And what we did is we had a fire in 2018, and after that fire, when we lost everything, we had to rebuild our homeless housing system from scratch. And we built a little different system. Historically, it's been based on rent, and that is the first thing that goes. We love rent, and we pay as much rent as we can for folks because we know that that's what they need. But we're also taking a very holistic approach based on relationship on how we serve the clients now. So it's not just rent. We're looking at substance use. We're looking at primary care. So we're not using the ER as primary care anymore. We're looking at mental health services. We're looking at legal services. We're looking at food insecurities, transportation, employment. Best way to get somebody out of poverty is a family wage job. So CAP is taking a very holistic approach to the way we're serving the homeless. And we have been doing that for the last few years, and we're going to continue to do that. And so as we look to the future, we need in this community, we need more units. There's a huge shortage of units. That's just a reality. We, at any given time during the month, there's people we can house right now, but there aren't units available. So we need units. We need rental assistance from the state or the feds, which is a huge part. And then we need this service-based delivery model. That's what we're doing. So we have a relationship. We also intertwine homeless families and individuals into other programs within the agency. I mentioned employment services. So we have employment services set up just for the homeless population so that when they come in, if somebody is ready, willing, and able to get a job, that's one of the first referrals we make. We make that in-house because we want to get people stabilized so that they aren't on the system forever. That's, I think, one of the core values of CAP is how do we get people and help them get not just a hand out, but a hand up and help them really survive because, you know, we don't want to see the same person back here in 5 years. We want to see them be successful. The greatest stories we have are people that have totally turned their life around and no longer need our help. And we would love to work ourselves out of a job, I think. And so anyway, that's kind of a summary of how CAP views homeless housing services and how we want to make sure that we're not just taking a one-time little shot at something. We want to really help the whole person, the whole family, make sure that it's super real in their lives.
I have a story that just stays in my mind forever, and the young woman's name was Nikki, and Nikki has been in the community a very long time, and came to the shelter to stay in the shelter, and over the years built relationships with the shelter staff at Chaplains on the Harbor, and others in the community. It was there that she was connected with resources, coordinated entry, but especially mental health services because She was suffering from mental illness. And so it was in partnership with the Behavioral Health Agency that we were able to wrap around her and really just walk with her in her difficult journey. Today she is in a supported housing situation and has been there for a while. And she occasionally visits around town and visits the people she knows. But she always goes back to her now home in permanent supported housing.
Successful models and programs show that it shouldn't be housing only. It should not ever be providing people just a shelter bed or just an affordable housing unit and giving them the key and walking away. It must include both the physical space and the services to meet that person's needs, to come alongside them and take those next steps together. The housing is an important first step in helping them feel safe and secure, but those wraparound services are really the key to long-term success and transformation. The issue seems complicated and above our capacity. However, when we review the needs of our community as well as simple pieces of a holistic solution, we can make significant progress towards the community we want to live in. We need all the elements of a successful system to see the results we all are working towards. Working together towards building and strengthening these three elements: the first critical element, place, the need for shelter beds and housing units. The second critical element, services, the match between needs and access, also reducing stigma to increase access. The third critical element, model, need for a model that includes housing and services, will drastically improve the health outcomes of all of our community members, reduce the burden on our strained public service sectors, and will inspire economic growth. As we commit to being present and engaging in conversations that are meaningful, we can change systems and lives. When we listen, hear, and keep an open mind to applying this information, we shift to a place of curiosity. As we listen and learn from all of our community partners, the building blocks of a system that serves our community become clear, and true transformation can happen.
We can do this as a community together, planting one seed at a time.